Our next speaker is Dr. Craig Sawchuk. He's a professor of psychology and division chair for integrated behavioral health up in Rochester.
Okay, so there's no conflicts of interest, and what I'm hoping to do with this talk is really complement a lot of the treatments that you're already doing for anxiety, but trying to look at some low-cost to no-cost resources to try to improve the overall care and outcomes of folks with anxiety disorders. So embedded within the talk, there'll be lots of different resources that hopefully you can take home with you. So what do we know about anxiety in primary care? It is a super common condition. I mean, I absolutely love anxiety, and we're never going to run out of being able to treat anxiety disorders, but they're among our most common condition that we see in our population-based studies, and not surprisingly, they show up very commonly in primary care as well, too. And then we look at, well, how does anxiety work in the medical setting? Well, it tends to be associated with a lot of health risk behaviors, so not so good health habits like smoking, more sedentary levels of physical activity, other things like that, which confers risk for chronic diseases as well. And the slide that Dr. Katzelnick showed earlier today about depression being associated with a wide variety of health conditions and chronic diseases, we can almost switch out the word depression with anxiety in that slide as well. And we all know in our own practices what happens when anxiety goes untreated. It's hard for them to engage in their treatment plan for their medical condition. So we have these evidence-based treatments for diabetes, cardiovascular disease, or even migraines. But when you get the noise of anxiety in there, sometimes it makes being able to deliver an evidence-based treatment that much harder. So it's really important that we focus in on this. And we've got a great opportunity because while anxiety is one of the most common mental health conditions that we see, we also have some of the best outcome data on treatments that actually work for anxiety. But as we also know, there's lots of barriers in terms of being able to access that care. Sometimes it is the lack of qualified professionals that are out there, or it's geographic barriers as well too. Stigma is actually getting better, but there's still a little bit of stigma out there. But several years ago, Murray Steen did a really nice study where they looked at the percentage of folks with anxiety getting some form of treatment, and that was right around 40%. That's been getting better, so folks are being able to access some form of care. But when you look at those folks who are actually getting care, only a small percentage of those folks are actually getting care, both behaviorally and pharmacologically, that are actually within